I would spend a little bit of time just looking at the specific needs of the older adult and give you some just some really good, I think, guidelines as to what to look out for and how you can really make a difference as a SPTA, because really it's about providing a holistic care and being the eyes and ears for the physical therapist. So our role isn't simply to provide exercise. Our role is not simply to practice good body mechanics, hand hygiene. Our role is not simply to be exercise experts and mobility experts. Our role is also to be just very solid healthcare providers and to be observant, especially those with multiple health conditions, or even one health condition. But I think in this case, with older adults, you're often looking at complex medical histories and multiple systems that are affected by various health conditions. And nutrition is one of those areas that I think, especially since we're spending sometimes 60 minutes with the patient, particularly in the hospital settings and the skilled nursing facilities and the hospital-based outpatient facilities or inpatient rehab facilities, we can really see what a person is doing in the room related to how they're eating, what types of foods they're consuming, and present those, or to discern whether or not perhaps someone may need help of an occupational therapist in terms of assisted eating, some devices to assist them in self-feeding, self-swallowing, or a speech-language pathologist if they are aspirating or coughing and having difficulty chewing or swallowing foods. So you see the objectives for the week, and really about how important it is to really, especially when you're going into these homes or these settings where people are spending a lot of time around food, or even an outpatient, to really notice what's happening. Is that person losing a lot of weight? Are they gaining too much weight in some cases? And it really could be a person maybe eating a lot of food but just having overall a real poor quality diet and maybe malnourished because they're not getting the appropriate foods. And this is in the case of somebody who either is having difficulty doing their own shopping, maybe having difficulty in the store, and they're just kind of hovering over in one or two aisles because they may be afraid to go into some parts of the store just out of fear of falling and just like to hover around a few shelves. There's maybe all sorts of reasons why people are not eating well. It's much more complex than simply basic food pyramid stuff and not being truly optimal in terms of buying the right foods. There's all sorts of reasons why people don't buy the right foods. So what I would like, and I think Bottomly does just an incredible job of just breaking down, what is the amount of kilocalories a person does need per day, and how is that person getting those calories? What types of fuel is that person getting? And we certainly aren't in the role, us or PTs, in telling people what they have to eat. We certainly can educate the patient and tell them what are good forms of protein. It's not our job to say this is what foods you must eat because of the limited background we may have in nutrition. We're not in that role as being nutritional experts and dietary experts, because we're not. You're not getting that curriculum in this course, and certainly not in the program. That would be a separate license that you're working under if you were to work as a licensed or registered dietitian. But we are eyes and ears, and we can provide some good basic information. We know what provides good bone health and what foods can provide good bone health. And so as we look at this, we can see how important it is that if a person does have affected or has impairments related to balance and such, what the results are. And a lot of this are things that you know, right? But I think it's really good to review, especially if you're talking about kidneys and other areas of gastrointestinal health. And then what I really like, what I've provided, is just a look at some of these chronic health conditions and how this nutritional problem can impact our role as healthcare providers and what can come up as barriers in our role as in progressing someone within the plan of care if they're having these different nutritional problems. So I think it's just really good information, and the more educated you are about these things, really I think you are just going to be a much better value for that patient experience and that patient caregiver family member interaction. And I think it's also just going to be very positive in terms of career development if you want to move on to being a director of rehab, or as you're going to these different case management meetings, then you can really provide some really good information and make those important referrals to other healthcare providers, which really can, in many cases, be vital to the vitality of that individual patient.